Good day, my name is Susan and I am here to explain how to conduct ethical nursing research. So what is ethics? First off, Webster's dictionary defines ethics as the study of standards of conduct and moral judgment. Moral philosophy, the system or code of morals of a particular religion, group, or profession. So it's a code of conduct. The International Code for Nurses has written a guide for nurses worldwide. It states it is a guide that defines ethical conduct for the profession, and a guide for action based on values and needs. It assists nurses in providing ethical caring for their patients, colleagues, and their communities at large. This gives the foundation for conducting nursing research, but there are also laws that govern research. The U.S. Department of Health and Human Services, 45 CFR 46, Human Subjects Research, gives further ethical and legal guidelines for conducting research. The FAQ states there are 3 fundamental ethical principles for all human subjects research: respect for persons, beneficence, and justice. These are the legal foundations for ethical research of any kind, so an ethical study incorporates the 3 principles of beneficence, respect, and justice. What is beneficence? It can most easily be explained this way. First, do no harm. Second, do good if possible. Respect means that subjects have the right to choose to participate. They will not be treated differently, nor penalized if they choose not to participate, or withdraw before the study is finished. They have the right to be fully informed about the study, the right to refuse at any time, and what the researcher's responsibilities and duties are. They also have the right to be informed of any risks or benefits that participation may carry. In short, treating the participants equally, and as you would want to be treated if you were a participant in a study. Finally, justice. Webster's dictionary defines it as honest, righteous, impartial, valid, sound reasoning. This means that participants have the right to be treated fairly. Agreements between researchers and participants must be honored. Study parameters cannot be changed without informed consent by participants. Subjects have the right to be treated with courtesy, and their rights to privacy must be respected. This brings us to ethical dilemmas. What happens when a situation arises where the rights of the participants and the demands of the study conflict? A famous example of an ethical dilemma is the Tuskegee experiment conducted in the first half of the 20th century. This was an experiment where men with syphilis were deliberately withheld penicillin, a known cure, because researchers wanted to document the disease in all its phases as it progressed. One might even say that this study is a case of research misconduct. The researchers' desire to see what happened overrided the need for the men to be cured of the disease. It is exactly because of studies like this one that institutional research boards were created. What is an institutional research board? Pollitt and Beck define it as an institutional group that convenes to review proposed and ongoing studies with respect to ethical considerations. The U.S. Food and Drug Administration FAQ states that an IRB has the authority to approve, require modifications to a study in order to secure approval, or disapprove research. The purpose is to assure that appropriate steps are taken to protect the rights and welfare of human subjects participating in research. They review the informed consent forms, the study parameters, and research protocols. Pollitt and Beck state the function of the IRB is to ensure that risks are minimized, that the risk-to-benefit ratio is maximized, that there is an equitable selection process, that there is appropriate informed consent and documentation, that safety is monitored, that privacy of participants is protected, and that any additional safeguards are implemented as necessary. Additional protections are required for vulnerable populations. Children are one vulnerable population. If they are over 7, the study should be explained to them in terms they can understand. They can choose to assent or deny participation. If they are over 12, written consent should be obtained. This respects children's right to self-determination, even though they cannot legally consent. Mentally or emotionally disabled are another. They have cognitive difficulties that can preclude them from giving informed consent. Consent must then be obtained from the legal guardian and research must be focused specifically on their disability. severely ill or physically disabled are a third type. Are they able to give informed consent, or are they too profoundly ill? Special procedures for obtaining informed consent may need to be used, such as using sign language for deaf participants, or audio or videotaping consent procedures. Again, privacy must be ensured. The terminally ill are a vulnerable population. The risk-to-benefit assessment is extremely important here, and health and comfort of the participant must remain paramount. Here too, special procedures for consent may be needed. Prisoners are another vulnerable population. Because of their incarceration, they may not realize they have the right to refuse participation, or may fear repercussions if they do not participate. They must understand that participation is voluntary, and that they do have the right to refuse without fear of penalty. Finally, pregnant women are a vulnerable population. Pollitt and Beck state they cannot be involved in a study unless its purpose is to meet the health needs of the pregnant woman, and the risks to her and the fetus are minimized. Data collection methods can be another cause of ethical issues. At times, depending on the nature of the study, the collection methods can skew results by causing a change in behavior if participants are fully informed of the nature of the study. This means that researchers must use covert data collection methods in order to get unbiased data. Concealed data collection, where researchers effectively lie to participants about what they are studying in order to get unskewed data, poses even more ethical issues than does covert data collection. IRB approval and participant privacy are absolutely vital. As you can see, legal issues arise out of ethical issues. Some questions to ask are: was harm caused? Were subjects coerced? Was informed consent obtained? Were the subjects exploited? So how to go about setting up a research study? Obviously, you have to have a research question. The first thing to ask yourself is what I'm studying of benefit to society? Then, you have to ask if the cost-benefit ratio justifies the study. Is the risk to participants greater than any benefit they might accrue? These questions are not just at the setup of the study, they must be ongoing during the entirety of it. The second step is designing and obtaining informed consent. Participants must be fully informed and understand all of the information about the research, the researcher's roles and responsibilities, and their own role and responsibility, as well as any risks or benefits. They must understand they can choose not to participate, and can withdraw consent at any time during the study. Pollitt and Beck note that aspects of informed consent include that participants understand the difference between research versus treatment, that they understand the study goals, that they understand the type of data being collected, and the procedures for data collection. They should understand the nature of the commitment and the time frame, as well as the number of contacts during the study. They should know who is funding the research. They should understand how participants are selected. They should understand the risks of participating, as well as benefits, and potential treatment alternatives. If they are to be compensated, they should understand in advance. They should know if the researchers have signed a confidentiality pledge. They should understand they have the right to withdraw or withhold information. They should know the circumstances under which the study would be terminated. Finally, they should be given the researcher's contact information in case they have questions. Given that most nursing research is qualitative rather than quantitative, participants should understand that consent is an ongoing process, negotiated collaboratively between researcher and participant. Objectivity is always an issue with research. This is where adhering to the laws, codes of ethics, and submission to an IRB can be helpful. Research misconduct is a growing issue. Some potential areas for misconduct involve financial conflicts of interest, fraud, protocol violations, and consent violations. It is extremely important to avoid these for the simple reason that the general public looks on nursing as an honest, ethical profession. If we engage in research misconduct, we are doing more than producing poor evidence, we are hurting our profession and our fellow nurses. If we adhere to the standards of conduct set out by the ANA and the ICN, we can avoid ethical conflicts and misconduct. Finally, as Bill S. Preston, Esquire, said in Bill and Ted's Excellent Adventure, be excellent to each other. Thank you.